Hi, my name is Diana Becerra, and in today's video, we'll be discussing important techniques used to improve swallowing safety and efficiency. These techniques are commonly used by speech-language pathologists to help individuals with swallowing difficulties or dysphagia, and we'll break down how they work and when to use them. Let's begin with chin tuck maneuver, which is designed to help protect the airway during swallowing, especially for individuals with delayed swallow reflexes or reduced airway protection. So how you perform chin tuck maneuver is you first take a sip of liquid or a bite of food, and then before swallowing you gently tuck your chin toward your chest, and this helps to narrow the airway entrance and protects the airway by moving the epiglottis downward, covering the trachea. After you tuck your chin, swallow while keeping the position. The act of tucking the chin helps to direct food or liquid safely down the esophagus and prevents aspiration. And I will demonstrate. So I will demonstrate the chin tuck maneuver, so I'll take a sip of my water. And it's kind of like you want that double chin, and I'll also show from the side. And you can use your hands like I did, or you can just move your head towards the back. And I'll do it without my hands. This technique is particularly beneficial for individuals with delayed or absent swallow reflex. It improves the airway protection by preventing food or liquid from entering the windpipe, reducing the risk of aspiration.
Hello, my name is Angie and I will be teaching the head rotation strategy. The head rotation strategy helps redirect foods and liquids to the stronger side of our throat, and this will reduce the risk of choking or aspirating the foods or liquids that we swallow. We will start by turning our heads to the affected or the weaker side. In this example, my weaker side will be my left side. We will turn or rotate our head to that side as if we were looking over our shoulder. It would look like this. So my left side is my weaker side and I'm turning to my left side. My right side is the stronger side and it opens up my right side of my throat to allow for swallowing. Now I will do an example with a sip of water. So first I will take a sip of water and then turn and look over my shoulder on my left side. So that would look like this. The right side opens up and allows for the liquid, the water, to go down safely from my right side.
Aspiration. Next, let's discuss effortful swallow maneuver, which is used to increase the strength and force of a swallow. It is especially helpful when there's reduced tongue strength or difficulty moving the bolus or the food or liquid back toward the throat. Here's how to perform effortful swallow. First, after taking a bite or sip of food or liquid, focus on swallowing with extra effort. As you swallow, imagine you're trying to swallow something thick or large. Engage the muscles in your tongue, throat, and jaw as if you're squeezing or pushing the food down. The key is to use more force than usual, concentrating on making the swallow as strong as possible. I will demonstrate the effortful swallow maneuver, so I will take a sip of my water. And it's just like very effortful, using all the muscles in my mouth. This maneuver is ideal for people who struggle with moving the bolus effectively from the mouth to the throat, or those who have difficulty with delayed swallow intonation.
Hi, so I will be explaining the Mendelssohn maneuver. So this swallowing maneuver is designed to increase the duration and the displacement of hyolaryngeal elevation by having the hyoid bone move anterior superiorly towards the mandible. So a goal of this maneuver is to be able to keep the larynx elevated for about 3 seconds before actually completing the swallow. and this action allows the laryngeal structures to be elevated and relaxes and opens the upper esophageal sphincter, which, when executed properly, leads to a safe swallow. So what I'm gonna do is I'm gonna take a sip of my water, and before I actually complete the swallow, I'm going to keep my larynx elevated for about 3 seconds. And you can kind of feel it, and if you need to keep supporting the larynx, you can kind of hold it in place like that, but I'm really gonna try to squeeze my muscles as hard as I can to keep that in place for about 3 seconds. So I'm gonna take a sip. And then I'm gonna relax it. So I'm gonna show a side view as well. And then I'm gonna relax it. So you really wanna try to keep this elevated for about 3 seconds and squeeze those muscles, and then complete the swallow.